House job is the time where you actually come out of your comfort zone. You have hectic duty hours, you are physically and emotionally exhausted, you struggle with your communication skills with patients and their attendants, you observe deaths and deal with traumatized patients for the first time in your life, and you learn to understand your rights and duties. Among all these hurdles, a house officer lives and grows. That's why house job is considered the time of much personal growth. Assalam alaikum, this is your fellow Isha Fatima. I hope you all are fine. I have done much research on house job which is still going on, and I'll upload a complete house job guidance series. This video is the first part of house job guidance series. We'll try to have a general outlook of what house job is. House job consists of four rotations. Medicine and surgery are compulsory. You must have to do 3 months rotation in medicine and 3 months rotation in surgery. Next two rotations are medicine allied and surgery allied. There are a lot of options for medicine and surgery allied. You have to choose one each for medicine and surgery, and this selection may base on your choice, your merit, and number of seats available. So 3 months rotation in each unit with a total of four rotations in a 12 months duration. Now let's talk about the eligibility criteria, salary and hospitals which are offering house job. You can apply for house job if you have passed final year MBBS. Government hospitals of Punjab offer a salary of about 67,000. This is for those HOs who choose their parent institute. Salary may vary in private hospitals. Federal government hospitals offer around about 80,000 to their HOs. All the tertiary care and teaching hospitals offer house job. Now let's talk about some medicine allied fields. Medicine allied fields are cardiology, pulmonology, psychiatry, dermatology, gastroenterology, pediatrics, neurology, nephrology, and radiology. Besides these are rheumatology, endocrinology, and anesthesiology. Same ways, surgery allied fields are gynecology and obstetrics, plastic surgery, neurosurgery, pediatric surgery, urology, orthopedics, eye, ENT, cardiac surgery, and trauma surgery. If you ask me about the easy rotations among these discussed, so I'll say it is difficult to give an absolute idea about a rotation. But factors which make a rotation easier are less working hours, more number of house officers, less emergency days, and more span between calls. So some rotations generally considered easier than others. Rotations considered easier are plastic surgery, urology, dermatology, psychiatry, ophthalmology, nephrology, and ENT. Till now, I have talked about the basic structure of house job. Now, I am going to tell you about some useful mobile applications which may help you to have better learning experience. First of them is Pharmapedia Pakistan. This application functions offline. You can search drugs by generic or brand names. It gives you much needed detail about the drug mechanism of action, indications, contraindications, brand names, available with dosing details in adults and in pediatrics. A must to have application for doctors. Next is daily rounds for important case discussions, Medscape for disease review, Oxford Medical Dictionary to search out difficult medical terms, and PubMed Hub for latest research journals. Let's have some idea of books for house job. Ah, again, these horrible books. Well, if you ask me about only two books, then they would be Doctor on Duty by Dr. Asif Ali Khan and Oxford Handbook of Clinical Diagnosis. Other useful books are Treatment Guide by Dr. Inayatullah, Churchill's Handbook of Differential Diagnosis, and Symptoms to Diagnosis, an evidence-based guide. I have attached the link to PDFs of all the books in my description. You can easily download them. Other than books, you will find PDFs for OPD cases of different wards, a list of instruments to buy, documents required to apply for house job, and other needed stuff. Stuff to buy for house job includes 2 to 3 scrubs, one apron, especially for those who are opting gynae ops, two comfortable crocs, one notepad, especially if springed, a good quality stethoscope, BP apparatus, glucometer, pulse oximeter, Inch tape, reflex hammer, tuning forks, pen torch, and a bag of adequate capacity for all these things. About paid or unpaid criteria, if you do house job in your parent institute, whether government or private, you will be paid. But if you want to choose any other hospital or you are a foreign medical graduate, then you can be either paid or unpaid. Each hospital has some paid seats for outsiders. You can visit the finance office of that hospital and check out which department has paid seats. Then choose that particular rotation to get your pay. That was all for our first part of the series. In the next part, I will discuss the frequently asked questions and dig into the details of each rotation, inshallah. Please like, share, and subscribe. Stay connected for more content. Thank you.